Dr. Avigail Lev, thank you so much for joining us here on the Science of Psychotherapy podcast. Welcome.
Thank you. I'm happy to be here.
And Richard here, of course. Lovely to meet you. We're very excited. We certainly got information about your books, and we'll talk about all those sorts of things. But just the general work you do is very exciting for us. And so maybe we could just start. We've given you a bit of an introduction, but just a few insights into yourself. You've been a co-author. Just a couple of things of what's brought you to this point where you are now.
I integrate. So all of the books that I've written have been about integrating schema therapy and acceptance and commitment therapy. And schema therapy is about schemas, which is core beliefs. And so I help people work with the core beliefs that show up for them in relationships and can create a self-fulfilling prophecy. So if I have a core belief, for example, of abandonment, that people will leave me in relationships, I've developed certain behaviors that I do to avoid the pain of abandonment, which often those behaviors lead to the same abandonment that I fear. So I integrate these two therapies. And I'm the director of the Bay Area CBT Center, which is a clinic in San Francisco. And I have a group practice with several other therapists. And we're all very close, and we make sure to challenge each other and hold each other accountable, because I think that's important. And I'm also the founder of CBT Online. And that is more for online therapy and also for tools with CBT and worksheets and videos and kind of resources for people to understand cognitive behavioral therapy better.
It's really, I look at that and I see you're what are you, early 40s or just coming up 40. You've been fabulously busy, very engaged in your experience. But I have a feeling from looking at your biography and talking about some of the things that you come across, and I want to talk about something specific in a minute, but it hasn't always been that easy. Have you always? It's not so much I don't know. I get the feeling you're a fighter. I mean, in a very positive way. You're sort of the world. You don't wait for the world to come to you. Is there a story behind that? What am I picking up?
Yeah, I mean, I guess I have this assumption that all of us are a bit of fighters, right? But I was born in Israel, and I moved to the United States when I was about 10, and I didn't speak any English, so I had a bit of a social alienation schema, if I had to choose a schema, and kind of this feeling of being different and unbelonging and needing to learn the culture and the language. So certainly that was a part of me wanting to understand people and human behavior and what makes people happy. Yeah. So I definitely struggled with feelings of unbelonging and sadness for sure.
Yeah, you use a term in some of the stuff of learning how to be neutral. Am I understand? Is that? I know there was another. I know we got a little catchphrase from when we look at some of the stuff. Learning how to be neutral in a world of toxic positivity. That's because you came from Israel, which is certainly a very positive nation, but to America, which is almost the land of positivity to a fault. Could you explain a little bit about this term being neutral?
Yeah. Well, I think being neutral is more specific for like as a therapist. So as a therapist, I think that it's really important to not lead the client. All of us therapists, we have certain ideas about what the right thing for a client to do or what their values should be or the choices they should make. But as a therapist, it's really important to work in a framework that allows the client to choose their values and their choices and the way that they make their decisions. And so I think as a therapist, that's really important. In relation to toxic positivity, acceptance and commitment therapy, the therapy that I do, ACT, it's based on the notion that we are not here to help clients get rid of difficult emotions. Like difficult thoughts, feelings, sensations, like internal experiences that feel difficult, our goal is not to get rid of those, but our goal is to change our relationship to those experiences so that they no longer have the same control or influence over our behaviors. But the dilemma is that we kind of live in a society that sends us a lot of mixed messages about what is in our control and what is not in our control. So when we live in a society that says things like, don't worry about it, calm down, relax, then we get this idea that we should be able to just control these things, right? That if a lion walks into my house right now, I should be able to control my physiological sensations of fight or flight. I should just be calm about the lion. And I think that causes a lot of human suffering. When we try to control the things that are out of our control, or when we think that something is out of our control that we could really change, those are the two ways that we get caught up in a lot of suffering.
So coming back to the therapist, when you say being neutral as a therapist, so that this is what you're getting at is not being overly positive. Is that what I'm hearing?
Well, there's two pieces. There's the piece about not being biased. So, if I'm sitting with a Trump supporter, for example, not indirectly being like, is this really consistent with your values? So being neutral in the sense of not leaking out my own values and morals on my clients, but having kind of a map that helps them become the expert in their own experience. Like, I'm the expert in psychology, but each client is an expert in their values, their needs, their experiences, and their decisions. And so it's really important for therapists to be neutral in that way. The toxic positivity piece is helping clients be able to dismantle and see how the system and certain ideas that we get sold are not really accurate. And so the dilemma is that we have a lot of mixed messages in our society about these kinds of things. Like we learn algebra and calculus, things that we don't actually need, but we don't learn, right, the important stuff about relationships and how to get our needs met and how to communicate effectively. And one big barrier in society, especially American society, is this idea that negative feelings, or even that feelings are bad and good. Like there are feelings that are bad and there are feelings that are good. There are sensations that are bad and there are sensations that are good. And part of therapy should be to keep all of the good positive feelings and get rid of all these negative thoughts and feelings. But in the reality of things, all feelings are feelings. All feelings are information about what we need, about our values, about how to move forward in life. Every piece of internal experience is a guide for what we want our lives to be about. And yet we live in a society that tells us to ignore and avoid these things. How do we live a valued life and a fulfilling life if we're not listening to our internal experiences?
Yes, that business thing of teaching them to say, "I feel fabulous."
Right.
Right. Or that actually even bringing it a bit more normal, or normalizing. When you go in to see your doctor, I always find this amusing thing. And hello, doctor, and the doctor says, "Oh, hello, how are you?" And you say, "Well, I'm fine, thank you." And then they sit down and say, "And what do you hear?" "Oh, I've got this, and I feel sick."
Right.
We get caught up in these sort of things. Yeah.
It's so funny that you said that, because when I came back from Australia, the first thing I told all my friends was, in Australia, when they ask you how you're doing, they actually listen to what comes next. And you can go, "I feel really anxious today." And they're like, "Oh, what's going on?" It's completely different. Like here in America, it's, "How are you?" "Good. How are you?" I mean, you don't even listen to the response. You're not even present with it.
Yeah, we get excited about if there's something wrong with you. Oh, you're in a really bad way. Fantastic. Tell us all about it. A lot of Schadenfreude here. But
so there is a real cultural bias that that we need to overcome, because people that are not trained in psychology or therapy, they will naturally respond sitting down with having a cuppa with a friend. There'll always be that encouragement to, it's okay. It's not as bad as you think. And so this is the cultural bias that we all have to sort of overcome.
Yeah, sometimes it is as bad as they think, isn't it?
That's exactly it. Sometimes it really is that bad. And the dilemma is that, if you check in with your own experience and think about the last time you were like anxious or upset, if somebody would say, relax, like when has that ever worked, right? Like who has ever been like, oh, like this, and then somebody goes, relax, and then you go, wow, I feel so much better.
Yes, I never thought of that.
Never thought, right. So it's like, it just doesn't work. So if we're getting the message that should work, then when we're all anxious, we're telling ourselves, relax, don't worry about it. Why am I upset? I shouldn't be that upset. Is it because I didn't have enough coffee? Is it because I had too much coffee? Is it because I don't have enough friends? Is it because of right? And we're just trying to figure and solve something instead of just recognizing that we're having an experience, we're a human being, and we could make space. It doesn't have to be negative. It doesn't have to be bad. It could be something to be curious about and to notice.
Yeah. So there's a word, curious, because I know that's Richard would say, let's, instead of saying, don't worry about that, he would say, well, let's be a little curious about that and look into it.
Yeah, it's interesting. It's interesting. Oh, there you go. Everything's interesting. But what it's interesting me as I listen here, because I've been doing some other work, and also it's very a loud bit of conversation at the moment, is cultural sensitivity and cultural responsiveness. But what I'm hearing with you is what I'm feeling too, is that every client, to some degree, is their own culture. There's a cultural sensitivity. There's a personal sensitivity that we need to have. Now, is this something that this sensitivity to the client, is this something that we can train in? Is it a life experience thing? Is it a combination? What do you find with your teaching and with when you're out with other people, how they manage?
As a cognitive behavioral therapist, I'm biased because I do think that it is about learning new behaviors. And I do believe that it's about, we could train ourselves and we could learn and we educate people and we practice new behaviors. So I do believe that this is something that we can all, on an individual level, and then also like on a global collectivistic level, is first really understand, what works and what doesn't. Like in acceptance and commitment therapy, the piece about acceptance is learning to accept all of our internal experiences. So our thoughts, our feelings, our sensations, our urges, our memories, all of our internal experiences, we accept, meaning we make the space and soften up to it and get more comfortable with what our inner world is like. And the commitment piece is we commit to doing a behavior. We commit to taking actions that move us towards our values, the kind of person we want to be. And the distinction is that our internal experiences are out of our control. The thoughts that enter into my mind, the sensations, those are not in my control. But the behaviors that I choose in those moments are always 100% in my control. And that's what we want to help people do, is change their actions.
Yeah. These things, we talk about it in the neurosciences, that really when you're talking about the subcortical regions where you're getting the amygdala and some of the other limbic areas, they're bringing up elements into our awareness and into our framework. But it's this prefrontal area, we talk the dorsolateral, the ventrolateral, and the orbitofrontal, that are all in there interrupting, checking out, looking for correctness or incorrectness, and making other decisions. So we are organized to have the thing emerge out of us and then frame it and often reframe it. Which I suggest is what you're saying. Does that make sense? How am I going, Matt?
I mean, that makes.
Sorry. Sorry, not just reframing, but then apply top-down control, which I think is then the very important part. Yeah.
Right. It's exactly top-down control. So we live in a society that has taught us or sells us this message that we should be able to control a sensation in the same way that I can, my phone. Like if my phone makes me anxious, I could just pick it up and put it in the garbage. But if a thought makes me anxious, it's in me. I can't just move it around as I do external things in the world. Like our internal experience can't be maneuvered in the same way our internal experiences are. And so, it's true in the sense that, our amygdala, these are evolutionary processes, very primitive processes of fight or flight and learning, right? Like these systems have been kind of evolutionarily set up to help us always look for threat and be safe. And then exactly our frontal cortex is then made to assess and take rational action. But all of these other primitive places in us, I mean, those are not in our control. And those are very much based in trying to find a way we're going to die, right? Catastrophizing and avoiding threat at all times.
Yeah, absolutely. Yes. 18 months ago, I can't even remember now, Richard, I was having palpitations and chest pains for seemingly no reason. And it was freaking me out rather. And after a number of different tests and quite some thorough tests, the cardiologist and doctors were saying, yeah, actually, you've got the healthiest heart for your age group that, we've seen, and you're completely healthy. And so it must be underlying anxiety. And once I had that schema, once I had that understanding, I could apply then top-down control over the bodily sensations. It dissipated.
Right.
Yeah, and these aspects of sort of anxieties, these external things, and relating to the internal, I'm going to jump a little bit because there was something in some of the talking points that really fascinated me, because you also look at dating culture in amongst the interpersonal relationships that you deal with. Now, personally, I've kind of a bit forgotten about dating culture, although my wife and I, we like to date each other, but we don't have to go through a lot of troubles. And there are a few words that I love that were put there, I suppose, to test me in my late 60s. Negging, ghosting, zombieing, and love bombing. This is the dating culture. These are the problems that are involved in it. What are the difficulties? What are the pleasures for people looking at their dating culture?
Well, certainly, I think that with technology and social media and the internet and everything that affords, it's much different than when we were younger. So I think that there's this way that it creates a bit of a domino effect, because people are behaving towards each other in this way in which everybody's more disposable or replaceable, and they just ghost, they disappear, they don't respond. And we're all kind of like little turtles. So we put our head out and we're vulnerable. We do something, right, that exposes us and tries to be intimate, and then we get hurt, and we put our heads back, in our shells, and it creates this domino effect. So you ghost somebody and the next person then ghosts somebody else. And it creates this whole kind of environment where people are feeling more lonely, more insecure, more disposable. And then it becomes even harder for people to make plans and be consistent with one another, or, end a relationship. Like as a therapist, I tell my clients all the time, the way that we end relationships is just as important as maintaining relationships. And what does that mean when we're, there's like a kind of avoidance of saying goodbye, avoidance of being intimate. It's a little bit like we're almost intimacy phobic, because when people could just be replaced or deleted in this way, it becomes even harder to open up and be vulnerable.
So this ghosting. Sorry, now I just want to catch up. This ghosting is making the other person ghost-like. I'm just thinking, is it anything like gaslighting, or is that a different thing?
No, gaslighting is when you make the person doubt themselves and feel kind of crazy in their experience. Ghosting is when you just stop talking to somebody. You block them, you stop talking to them, you don't say goodbye, you don't say why. It could be after you met somebody once, or it could be after being with them for 3 years. It's not just in romantic relationships, right? It's become more of the norm with texting and things like that, to sometimes not respond for days or just disappear. And so you could also imagine that then people become more anxious and insecure if somebody doesn't respond right away, because we have a culture where people could also just disappear. They could know you for a year and then disappear.
Mm-hmm. Okay. Thank you. Like Richard, dating is a long time in the past for me too. So I'm wondering, is it more difficult in this current culture, or are we just talking about human nature and it's always been like this?
I could only speak from my experience with my clients. And if I'm speaking to that, it seems like, yes, it is much more difficult in this culture. Yeah.
And the reasons are?
I think that some of the reasons are related to technology and social media and the ways that has made us become more comfortable with vulnerability behind a screen as opposed to in person. Also because of Trump, and when he created a bit of a gender divide and a lot of animosity, racial, and so that also makes it difficult to be intimate and trusting. And then also another aspect is the global pandemic. I mean, I think about this global pandemic, and it's almost like we've all had a global trauma together. It's a real collective trauma. And when we've had a year and a half of being under a pandemic where we could either kill somebody else by breathing near them, or they could possibly kill us. I mean, what does that do for our connections and for like our desire to meet new people and put ourselves out there? It really goes into our schemas, right? Into our primitive brains. It's not even a conscious thing we realize.
Yeah. Wow. Really difficult landscape.
And this will affect different generations or people at different stages of their life. I was thinking about this the other day when someone says, "How have you gone through the pandemic?" And I said, well, interestingly, my wife and I looked at each other after a couple of years of this thing and said, actually, we're quite dull people. So, but in the sense that it hasn't been so important for us to meet new people, to engage. We've got lots of friends, we've been around, and so on and so forth. But then when I look at some of the other people in our family at different ages, there's exactly what you're saying there, particularly those in the teens, late teens, and teens and early 20s, of meeting people. And this is interesting, this possibility of creating a generational schema that is going to be problematic later on. Is this something you're concerned about?
Yeah, for sure. I think it is the hardest on teenagers. I mean, imagine being a teenager and being cooped up like that, and your brain developmentally is needing these things, right? I mean, we're not going to know the long-term impact for a while, right? I mean, I'm a psychologist, so in some ways I'm always believing, in change and that our brains are malleable and that we could get through things. So it's not hopeless, but I think that it means that we have to acknowledge it. Like if we don't see a problem, right? If we don't acknowledge, if we don't acknowledge what we've been through, then we can't really fix it or work on it.
Yes, that thing of post-traumatic growth, as different from post-traumatic disorder, distress. And part of that, I think, comes back definitely to what you were saying when talking about the social disruptions, the political disruptions, this the benefit that we get from having a common goal. And I think this has been one of the greatest difficulties with this pandemic. We've had sort of two sides to things in some way, two versions of the truth. And I found that very difficult to manage. Is this something you're seeing with clients yourself?
Yeah, I do agree with you that one of the things that has made this so much worse than it could have been, at least in the United States, is this split and the divide and people going after each other, all for having different opinions. And that certainly makes it a lot more difficult.
Yeah, that's a trauma in itself, isn't it?
Right. And it's interesting because, Viktor Frankl, who wrote Man's Search for Meaning and The Doctor and the Soul, he really distinguishes between how every instance of trauma is an opportunity for post-traumatic growth. Like you could have, PTSD, or you could have post-traumatic growth, which I think is really beautiful, because he says in every moment of suffering or pain, there's an opportunity to create meaning and to grow from it, to expand yourself and to move towards values and create meaning. So I think that it will be really important for individuals and for us as a collective to make meaning and make sense of this so that we could grow from it.
Yeah. And that does seem to be very difficult in the midst of it, which we still seem to be.
That's right. It's like, I think that, we haven't actually moved into the post yet, right?
No.
Yeah, that's right.
The dilemma some people think we have, but we haven't.
One of the other talking points, again, jumping, I'm sorry to do that, but it's so interesting, all the things you've got, is because I recognized it and took I went as I looked at this, because it was very similar to work that I've done with Ernest Rossi and his work with Milton Erickson before him. And it was simply a thing saying that sometimes in order to be able to learn how to control some of your powerful emotions like anger, and I would imagine, maybe even anxiety and some of those things, is to actually feel more angry, is to actually get someone to feel more angry. And I know that we also have this with, and now I'm going to forget his name, which is dreadful, but a friend of mine who also encourages people to get more anxious in what they do in order to do it. What is some of the work you're doing that? Because that's also involved with the CBT and the ACT work you do. How does that help in this process?
Well, I mean, what you described is like a paradoxical intervention, because when somebody's really anxious and you try to get them to be more anxious, they kind of see how hard that is to do. And then they could have an experience of what it feels like to drop the struggle with the experience. Because often what happens is that in our experience, it's not the actual pain that causes us so much pain. It's the struggle with that pain that causes us so much pain. And the more we drop the struggle, the more flexibility there is with the pain. And the more we struggle with it, the worse the pain gets. It just gets worse and worse. Sometimes it's better to do like, ACT is very metaphorical and experiential. So sometimes it's better to do an experiential exercise to help articulate these things. I could do a little experiential exercise with that.
Fantastic. You're going to perform for us.
Yeah.
No, beautiful. No, that'd be lovely, because a lot of therapists out there, and they really love to hear specific, practical, functional things we can do. So please go ahead.
So if this is like a typical ACT metaphor, and there's a lot of metaphors for this kind of thing, and I'll tune it up a little bit. But if we say that, let's say both of your headphones, right? These headphones you're wearing are very sensitive polygraph machines. And so as long as you're hooked up to these headphones, I'm able to tell any physiological change that happens to your body. Like if your hands get shaky, or your heart starts racing. Like I'll know like this, it's so sensitive. So if you feel any tiny bit of anxiety, I'll know.
Actually, Matt and I both sat up straight. It was really
right.
Just from that metaphor, just from that, we've already started.
So
okay, we're with you.
So then I'll say, as long as I'm in this interview, whatever you do, don't get anxious. Do not get anxious. What do you think would happen?
I'm not thinking of the purple cow.
Heart rate's going up. Yep.
Right. So now we'll imagine I'm going to say there's a bomb hooked up to this. And if it senses that you're anxious, it is going to explode. You can't get anxious. Whatever you do, it will explode if you get anxious. Don't get anxious.
All right. I'm gone.
And actually, what I found was I started altering my breathing. I tried to do something to calm myself.
Right. And usually I do this in person. So I say, I have a gun. If you get anxious, I'm going to shoot. So don't get anxious. And then we notice that all of our physiological experiences are out of our control and most of us would get shot. But if I say to you, oh, give me your red pen or I'll shoot you, what would you do?
Here's your pen.
Laugh.
You'd give me the pen.
Yeah.
If I would say, give me this piano, mail me this piano, or I'm going to shoot you, what would you do?
Yeah. These are interesting. These are interesting challenges.
Well, what would you do if I said, send me this piano and send me this book, or I'll shoot you? What would you do?
Over Zoom.
Mm-hmm. No, I just mail it to me.
Yeah. And this mortal threat is terribly distressing.
Sorry, to answer your question, I'd have to try and talk you down on that one because I love my piano.
Well, then you'd get shot.
Okay.
Yeah.
What if I said I would go, give me one of your books or I'll shoot? What would you do?
Right. If I really felt it was a real situation there, have the book.
Right.
Yeah.
And so this is a great example of noticing that your physiological experiences were completely out of your control, but your behaviors were completely in your control.
Right.
So even if you're anxious at 110%, if I say, give me the book, you'll give me the book. If I say, dance like a chicken, you'll dance like a chicken. If I say, give me, your glasses, we still have 100% control over our actions, regardless of how strong our emotions are.
Yeah.
But we do not have the same control over our internal experiences as we do over objects in the world. Sure. And so when I work with clients, I let them know, I'm not here to work with you to help you not have these experiences. Mm-hmm. What I am here to help you is notice when you're turning the gun on yourself. When are you going, I shouldn't be anxious. I shouldn't feel guilty. I shouldn't be scared. I shouldn't feel this. And notice that as soon as you turn the gun and you tell yourself not to have an experience, that experience starts growing and gets worse and worse. And what I want to help you do is lower the gun, start being kind with yourself, noticing where in your body you're feeling something. What is that like? What color does it have? What shape does it have? Building compassion to it, like putting your hand on your heart and saying, it makes sense that I feel scared right now. Of course I feel scared. And noticing that when we have this compassion and when we're willing to have our internal experiences, we have even more control over the actions we take.
Right.
So if I'm anxious and then I'm spending a lot of money or I'm yelling at my friends and I'm saying you're all jerks, then I get even more and more anxious because of my behaviors. But if we could choose the behaviors we want to do under this stress, then what happens is we then end up having more flexibility with these experiences. We don't continue to do the behaviors that make us feel worse and worse and worse.
Yeah. I can turn around and get the book, send you the book, so I can do that behavior, which will stop the terribleness of the threat, even while my anxiety is still continuing. So that emotion, I can't simply, that's doing that, but I can do this action. And so maybe I can do another action which starts to go inwards. Yeah.
Now, just a disclaimer for our listeners, we're not suggesting that in therapy you pull out a handgun and point it at your client.
Yes, when we were doing this, it was all done with fingers.
That's right.
Well, for those who are listening, because they'll be listening on the podcast.
Yeah,
don't tell them about the machete I brought to the podcast.
No podcast hosts were injured in this recording.
And, nor did we send any more. It's a lovely, but it's a confronting exercise. But sometimes we need to do this. I know I've got a couple of clients at the moment, and there's one that I'm extremely gentle with. And it's very important. I'm respecting the culture in that client's framework. But another one, I'm actually entirely reactive with.
Right.
And that's also to do with her history, that what she has come to accept. Anything. So if she's rude to me, I just shut it down like her dad. I'm old enough to be it. And it's really interesting how, as a therapist, I feel entirely reasonable. I'm not sure comfortable is the word, but reasonable to be doing both behaviors. And I certainly wouldn't imagine swapping them or wouldn't make the mistake. And I think this is what you're suggesting.
Well, I think also that's a great example of what I mean by neutrality, right? Is that you're not coming from your own actions and your own biases, but you're letting the clients guide you. Yeah. And so in some way, that's a great example of neutrality. But the exercise, it's like, I have a lot of clients that say things like, I can't do this because I'm anxious. I can't do this because I'm tired. And in the reality, your behaviors are just as much in your control, regardless of your experience. So for example, in that first example I gave you, if somebody has a core belief of abandonment, as soon as all of those sensations and feelings of being abandoned comes up, they may do the behaviors of clinging, seeking reassurance, going, why aren't you calling me? Where have you been? You don't love me. And then the more they do those behaviors, the more likely they are to get abandoned. If they could have that experience, make space for the abandonment, have all of the internal experiences that come with abandonment, then they could choose not to do the behaviors that are more likely to cause more and more abandonment.
Right. Yeah. These are the processes, and these lovely books, and written with some other authors, which is great because Matt and I write together. We've got something coming out next year. We love doing that. So what have we missed? Is there something we sort of better wrap up? We've kind of got to the end of our time. We know people drop off after about 40 minutes or so. Is there something you'd like to wrap up with, or something that we've missed that's particularly relevant? You give us a little wrap up in that case.
You could visit my website at www.bayareacbtcenter.com or cbtonline.com, or you could find my books on Amazon, or you could email me at info@bayareacbtcenter.com.
Beautiful. Okay. That's lovely. And we'll have links on for everything on our show notes. So we'll put all that there. So if you're listening, you just look at the drop downs and you'll find all that stuff. And Matt, I think we've had a beautiful opportunity here with Abby. It was great.
Fantastic. Dr. Avigail Lev, it's been wonderful and great to get to know you and learn about your CBT and ACT and everything. And we just encourage everyone to jump onto those websites and grab those books and some wonderful resources there for you. Well, I hope sometime in the future we might be able to catch up with you again.
Yes, I had a lot of fun. So thank you for having me, and I hope to chat with you two again.
Beautiful. So bye-bye for now.
Okay, see you later.